Hello everyone. Today's topic is blood and their disorders. Blood is a body fluid in humans and other animals that delivers a necessary substance such as nutrients, oxygen to the cells and transport metabolic waste product away from those same cells. Blood is a specialized fluid of connective tissues and contains cells suspended in a fluid matrix. Functions of blood: transport of dissolved substance, regulation pH and ions, and restriction of fluid losses at injury sites, defense against toxins and pathogens, stabilization of body temperature. Next is physical characterization of blood. Cold range, this oxygen rich blood is a scarlet red and oxygen poor blood is a dull red. pH must remains between 7.35 to 7.45, slightly alkaline, and blood temperature is slightly higher than body temperature. 5 to 6 liters or about 6 quarters per body. Blood plasma composed of approximately 90% of water. It includes many dissolved substances such as nutrients, salts, respiratory gases, hormones, proteins and waste product. Next is the plasma proteins. Albumin regulates the osmotic pressure and clotting proteins that helps to stem blood loss when a blood vessels is injured. Antibiotics that helps the body from antigens. Next is erythrocytes. Erythrocytes means red blood cells. The main function of red blood cells is carry the oxygen. Anatomy of circulating erythrocytes is biconcave disc, essentially bags of hemoglobin, and then nucleated and contain very few organelles and white blood and outnumber WBC is 1000 to 1. Hemoglobin. Hemoglobin containing proteins and bind strongly but reversibly to oxygen. Each hemoglobin molecule has 4 oxygen binding sites. Each erythrocyte has 250 million hemoglobin molecules. Next part is leukocytes. Leukocytes is white blood cells, crucial in the body defense against disease. These are complete cells with nucleus and organelles, able to move into and out of the blood vessels. This is diapedesis, can respond to chemicals released by damaged tissues. Leukocytes level in the blood. Normal level is 4000 to 11000 cells per ml. Abnormal leukocytes level is causes leukocytosis above 11,000 leukocytes per ml. Generally indicates an infection. Leukopenia, abnormally low leukocyte level, commonly cause certain drugs. Types of leukocytes: granulocytes and agranulocytes. Granulocytes are granules in their cytoplasm can be stained and include neutrophils, eosinophils and basophils. First is neutrophils. Multilobed nucleus with 5 granules act as a phagocytes at active site of infection. Eosinophils, large big red cytoplasmic granules, and it is found in a response to allergic and parasitic worms. Basophils have a histamine containing granules, initiate inflammation. Second type is agranulocytes, lymphocytes and monocytes. Lymphocytes are nucleus filled most of the cells, play an important role in a immune response. Monocyte, large of the white blood cells and function as a macrophages, important in fighting a chronic infection. Third compound is the blood of platelets, derived from ruptured multinucleated cells, needed for a blood process. Normal platelet count 3 lakh per cubic mm. There are also some blood disorders are present. Blood disorders can cause various symptoms in almost any area of the body. Most commonly, symptoms are caused by decrease in blood component. Decrease in RBCs and hemoglobin can cause symptoms of anemia such as fatigue, weakness and shortness of breath. Decrease of white blood cells or immune system protein can cause recurrent fever and infection. Decreased platelets or blood clotting factors can cause abnormal bleeding and bruising. Increased RBCs can cause thickening of blood and thereby can cause a headache and red complexion. Increase in WBC or immune system protein also can cause thickening of blood. Increased platelets, that is thrombocythemia or a blood clotting factor, can cause inappropriate excessive blood clotting. When blood disorders can causes a person blood to become a thinned and thickened. Blood may have difficulty passing through small blood vessels and decreasing blood flow to certain area of the body, which is a serious condition called hyperviscosity syndrome. Affected people may experience symptoms such as shortness of breath, headache, dizziness, and confusion. Hyperviscosity syndrome can occur in people who have multiple myelomia, in which it is caused by increased immune system proteins. Blood disorders often causes symptoms that can cause occurs in other disorders. For example, weakness and shortness of breath caused by anemia can be caused by other conditions that impair oxygen delivery to the body, such as heart or lung disorders. Also, easy bruising, symptoms suggested of blood disorders, can be caused by other conditions such as disorders of the blood vessels or the use of various drugs such as aspirin. Blood in urine or stool can be caused by blood disorders, but it is usually caused by abnormality in the urinary or gastrointestinal tract.